40 years from Army, and then I shifted and moved over to at the Globe Dental Clinical Services. You know, when I moved to this side of the practice, that is the practice in a civil setup where the dental practices are not so well organized as the medicals have been. We realized a lot of things. The first and the foremost was a very severe lack of awareness, which in the armed forces we could cope up with, we could manage, we could win over. But here, we found that was one of the very major challenges, that the awareness about the dental treatment and the dentistry as such was not so well accepted or not good enough in our country. Huge, very huge reservoir of dental surgeons, immense. And that too localized in the urban areas. So that means largely the rural areas or the semi-rural areas the dentistry is not reaching. And a large amount of people are not getting the quality dentistry. This unorganized way of dentistry, of opening up a clinic anywhere, and the lack of the regulatory body who could supervise the way it functions was another very big issue which we realized has to be coped up with. So we had to come up with a standardized way of practice and a dental practice which can deliver quality care across all echelons in our 310 clinics. We are now 310 clinics across 26 different cities in the country, and it was a very big challenge as to how do we do that. And I'll share the same scenario that we did that in a similar manner, that first we put our quality structure online. We went through our dental quality management as a separate vertical. And that was the first one to come in place. And that was not only to see that the quality in treatment, but also quality in the infrastructure, quality in our data management, quality in our diagnosis, treatment planning. And we had auditors or surveyors, as you would like to call them, who visit each clinic twice every month, and they minimum spend half a day. So you can imagine that if a person has to spend 4 to 5 hours in a clinic which is about 1,200 square feet, so each nook and corner, each procedure, each process, each system they set, including code blue and code red. That's done every month twice with every clinic. So that we have, and that reports directly to CEO. It doesn't report to anybody else. So that quality system, what you had brought from abroad, in a way, we brought a lot from the army, and then we put in together what was going on in the national accreditation bodies here, plus what we took from the Royal Society of Medicine, London. So all those put together formed one part of quality, and the second part of quality was dentistry. From the back end, we can see a lot if you have your data completely digital. So every patient of ours, the complete photographs, X-rays and the data is fed in the computer the same day. It has to be. So from the back end, we analyze something like 12,000 patients from the back end every month as to seeing that what has been done. And that information then we have to share in a very sensitive manner, which I asked you, with our doctors, so that we make them better in their skills. So this is what we could achieve, and what I shared with you previously, that was what I largely felt was the difference between a space abroad and space in. And lastly, here every patient has to spend from his pocket. It's not being paid out of insurance, especially the dental treatment. So this is where we are now working on, and government has already taken a very positive step towards it, and I hope something will be done for it. Thank you.
Thank you very much, Dr. Arora.